Good afternoon. My name is Kayse, and I'm the Chief Media Strategy and Partnerships Officer at the Ad Council. I'm so thrilled to be here at the 2021 OAAA Media Summit among so many leaders in this industry. And it's no secret that this past year has tested everyone in so many different ways. And the out-of-home industry is no different. So many advertisers hit the pause button as they realized so many people were staying at home. But I know this is just an anomaly, and the out-of-home medium is poised for explosive growth. It's a medium that's known for its ability to provide reach at scale and drive action. And now with technological advancements in data and technology, digital capabilities, advertisers can get hyper-targeted at scale, providing targeted reach against specific audiences in real time in specific geographic and cultural locations. At the Ad Council, we know out-of-home extremely well. It's played such a significant role in our history to drive awareness, drive change, and create impact. Smokey the Bear posters reduced forest fires from 8 million acres to 200,000 acres. Littering is no longer tolerated. We moved from 1 in 4 people wearing seatbelts to 3 in 4. And we together have reduced the number of deaths due to texting and driving. So it's certainly no overstatement to say that the COVID-19 pandemic has been the biggest public health crisis of our lifetime. And as an organization, we knew we had an obligation to meet the moment with the most ambitious public education effort in our history. In February, we launched the campaign, It's Up to You. I hope you've seen it. This message is simple, and it directs consumers to a website, getvaccineanswers.org. This education initiative is designed to ensure that Americans have accurate and timely information to answer their questions and concerns about vaccine side effects, efficacy, and clinical trials. As we have in the past, when we have annually benefited from over 100 million in donated media from the out-of-home industry, we are turning to you again to help support our messaging. It's such an important part of our overall strategy to help inform and drive awareness in areas of the country where hesitancy and concerns about the vaccine are the greatest. Programmatic digital out-of-home is playing a critical role for us, geo-targeting audiences where they live, work, travel, shop, and play in a variety of formats, offering unparalleled place-based engagement. And on April 15th, we launched an industry-wide effort in partnership with the OAAA, which has been an amazing partner, incidentally. But we've been creating a national roadblock. OAAA is using its platform to send alerts reminding you, the member companies, to go to the site, order printed materials with our It's Up to You campaign. And we expect the campaign to run on thousands of traditional billboards and digital out-of-home screens nationwide. It's expected to generate more than 1 million in static and digital out-of-home donated media. As ever, we are so grateful for OAAA's support in making this possible. We continue to uniquely partner with others within the OAAA membership. Here are some great examples. We're working with Intersection Link NYC. I love this technology. It's a smart city product and we used it to blanket New York City, a city that was so hard hit by COVID. And of course, we turned to Firefly, an taxi top advertising institution that's been so successful for us. And finally, for those of you who live in the Mid-Atlantic region, I hope you'll see it on the roadways. We've worked with Trans Promotion and we'll be on road trucks, on the sides of trucks, on the road for the next 3 months, offering 5 million impressions. So many unique ways to leverage the strength of your industry. And as you know, we still have a lot of work to do. But please know our efforts have moved the needle to reduce vaccine hesitancy, and Dr. Grant will talk more about that. But as of today, about 60% of the population has either gotten or intends to get the vaccine, which is up from 40% 3 months ago. This industry can take great pride in the role that it's placed in this monumental effort. So today, I'm excited to breathe life into this initiative by bringing you to an incredible leader who is also partnering with the Ad Council to lead this industry effort, where we can address misconceptions and concerns around COVID-19 vaccine safety and effectiveness. Dr. Ernest Grant, President of the American Nursing Association. Welcome, Dr. Grant. It's so great to see you again.
Thank you very much for having me. Happy to be here.
So Dr. Grant, you have been in the thick of this with us since we conceived of this whole effort. Can you just take just a moment to describe you, the ANA, and the role that the ANA has played in Ad Council's COVID-19 vaccine education effort?
Certainly, I would be happy to. I'm the 36th president of the American Nurses Association, which represents the interest of the nation's 4.3 million registered nurses. The ANA has partnered with the Ad Council because we realize how important it is for the American public to have their questions answered regarding the vaccines and also just COVID infections in general. We realized early on that people were more likely to get vaccinated if all the questions and concerns that they had were addressed, and also that the information should be coming from someone that they trusted. And who better to trust than nurses, who for the 19th consecutive year in a row has been voted by the public as the most trusted profession in the annual Gallup's Ethics and Honesty poll. Also, nurses who've been vaccinated themselves can also tell their stories, which also goes a very long way to help alleviate some of the concerns that people may have. But we also realize that more can be done, and there's still, a lot more that we need to do as far as getting the message out regarding the vaccines. So
how do you think we're doing so far, given that this is the biggest public health issue of our lifetime? I talked to the numbers a little bit earlier, but how is vaccine adoption trending across the country based on what you're seeing, and how are we tracking against expectations, Dr. Grant?
Well, we're doing very well. Obviously, when the emergency use authorization was first implemented, we saw a huge upswing. People who were very anxious and wanted to get the vaccines, they had done that, and and things were going pretty steady. We could say that we've hit a couple of roadblocks, but things are still going very steady. Now it's important that as we begin to work on access or getting the vaccines to people who have difficulty coming into the big city. So we're looking at bringing the vaccines more to the rural areas of America, or places where people may not have quite the adequate transportation to be able to get to those sources, actually bringing the vaccines to them. Also, obviously there's the cultural differences as well, and so we have engineered several campaigns that recruited people from similar cultures to go out and advocate and help to answer the questions and concerns that people may have. That too has helped to increase the amount of people who are going from vaccine hesitancy to vaccine competency, as we like to say, to make the decision to go and get the vaccines. And I think as the country opens up even more, and we're beginning to see the public realize what they could be doing if they were more vaccinated, more people vaccinated, that too is helping to drive up the vaccination drives from that lull that we saw several weeks ago.
You had mentioned the importance of getting into the rural areas outside major cities. Speaking from an audience demographic standpoint, which audiences at this moment are the most critical to reach with this effort, and why?
There's several audiences that are very critical to meet. Obviously, again, Black and people of color. Obviously, the Native American reservations. We're hearing great results of what is happening in a lot of the areas, but there's still some areas out in like the various mesas out in Arizona and the Southwest, where it is still, very, very difficult to travel. They may not necessarily have, the connection to the World Wide Web and et cetera. So, messages that they may be able to see either, via television or radio, may be difficult for them to have access to that. So, again, using public health nurses and other people who literally are either driving out in their cars or going in on horseback or donkey or whatever else to to take the vaccines to the various populations. You think of very rural Alaska, places like that as well, or what we would call critical access areas. These are some of the the places that we need to target right now and are targeting to make sure that individuals do get the opportunity to take the vaccines and provide that vaccine education that they so crucially need.
You just provided such great messaging to the out-of-home industry because they play such an important role in all the areas and the audiences that you demonstrate. And that's why it's so critical for us to continue to lean into this effort and not take our foot off the pedal. So thank you for really expressing that so articulately. I think it hopefully resonates with this group. And as this audience thinks about ways in which to engage, please take to heart Dr. Grant's recommendations on where
Yes.
we have to lean into. So people still are unsure. And what are some of the questions that people are asking even today when we feel that there is so much adoption of the vaccine to where we are? What are the concerns in this moment that you're hearing?
A lot of it is really just people are hearing about the quote unquote side effects, but that being the sore arm, the fever, feeling, fatigue, chills and things like that. And it's important that we educate them that those side effects are a good thing, because it means that the body's immune system is working, and that they will the body is building up immunity to the virus. But I think so much has been made about that's what makes people a little hesitant. And of course, there's still the individuals who maybe are just afraid of needles, as well. But it still is just you get choice of either one shot and done, or you can obviously get the two-shot regimens as well. But it's still just important that we answer those individual concerns that they may have. And also we have to play against the rumors that may be put out there out on social media, as far as that it may change your DNA, or that there's a chip and things like that. All of those are untrue. They're but those are things that we have to answer, or be able to answer those questions against, and get, again, just really setting down. And it's more or less like a one-on-one campaign. If I go to you and say, Kathy, what is your concern if you were hesitant about taking the vaccines, then I can answer all your questions. Whereas the person behind you may have a totally different set of questions or concerns that, again, by setting down and answering their questions as well, that would alleviate any concerns that they may have, and they may be encouraged to go ahead and take the vaccine now that they have had all their questions answered. So it's sort of a one-all, catch-all, but you also have to sort of, make it, individualized, so that each person feels that, I've gotten my, the concerns that I have, I've gotten those answered, and that's what's so important.
Yeah, in the research we conducted, facts were so critical to the messaging, and it was less about getting the shot and more about giving individuals the information so that they can determine what's right for them. And as I think about where we are today, Dr. Grant, Pfizer just approved, if I'm not mistaken, the vaccine for 12 to 15-year-olds.
Yes.
I'd love to hear what your thoughts are and what we should be saying to parents.
I think that was an excellent decision that, that there was approval of emergency use action for that age group as well, for a number of reasons. One, we know that, even though there were few cases of individuals in that age group contracting COVID, they were also carriers though. And when you think that if they're in a multi-generational household, then they could unsuspectingly bring that in and perhaps infect their parents or their grandparents or even great-grandparents if they are there. So the more we have learned about the virus and how it how it's transmitted and et cetera, has really helped to turn the tide. So again, by vaccinating this age group, and hopefully, within the next couple of weeks or so, we'll be able to go even lower. We'll be able to help eradicate this virus. Also, this helps to, open up the country more. If the kids are vaccinated, then that means that come this fall, they can go to school and, have, assurance that, the chances of contracting the virus is extremely low, and, won't have to, be as, still at home, learning that way. We know that over the past year, as we've seen reports come out, kids have really lost a lot by not being able to go to school on a daily basis. And some kids just don't learn very well doing online learning. They need that one-on-one, type of instruction that has really been very beneficial. The other thing is obviously, as we're also seeing, as more and more the country begins to open up, the ability to get back to doing things that we considered normal, going out to dinner, going to a football game or a baseball game, or going to the movies, by vaccinating that younger age group as well, we're still allowing for, things to return to normal. And finally, we're also decreasing the potential that there may be some variants of the vaccines that may begin to grow and perhaps become resistive to the vaccines that we have. So, those 3 or 4 things there are essential as to why it's important that, the vaccination for the 12 and older now is so crucial. And as I stated, hopefully within the next couple of weeks or so, we'll see that there will be approval for individuals, I believe, 5 years of age and older as well.
Oh, wow. Well, we are definitely, as an organization, leaning into identifying medium that help to reach parents in throughout the country and in rural communities. So again, another great reason for this industry in particular to continue to support the work and the messaging. Just another question I had, just relative to your membership, Dr. Grant, how are nurses faring today? It's been such a heavy burden, and they're so passionate about their work. I mean, what are you doing to support them, and what's their mental state now?
Well, thank you for asking. As we're taping this is right in the middle of National Nurses Month. And actually today is International Nurses Day. And for the past year, nurses, we've always been there to answer the call to our community, our country, and in this case, the globe, the whole world. We have done so with a lot of diligence, a lot of pride, but I will admit that they are extremely exhausted. They are suffering a lot of not only mental fatigue, but also just extreme exhaustion as well. And some of the best things that I have been encouraging the public to do is, consider getting the vaccine, wearing the mask, and et cetera. It's the greatest gift, or the thank you that you could give to nurses and other members of the healthcare team, is to do your part to help drive down this vaccine, this virus by getting the vaccine, and encouraging others to get vaccinated. If you yourself are vaccinated, that's the best thing, so that healthcare workers can have a break. If you really stop and think about it, they have literally been working nonstop for these past 14, 15 months. And it's really grueling. And I want to thank my nurse colleagues who are still on the front line and still reporting to work every day, even though it is very grueling and exhausting. They are, being true to the profession and answering the call, because they are needed. And I couldn't be more proud of the profession, and more proud to call myself a nurse for the things that they are doing.
Well, we are so grateful, and certainly they are definitely in the front line of fire in this whole challenge, and I'm just so grateful for everything you're doing to lead this group. So as we look to the future, and I'm not asking you to predict, but maybe I am, and it's just, where do you see us living in a way that we were living prior to the pandemic, where masks won't be required and we'll be able to really get back to the moments that we all missed? Do you see that in the near future, or do we still have a lot of work to do?
Well, it's a combination of both. We still have a lot of work to do, and we're still making this concerted effort to get more and more of the American public vaccinated. And obviously, the more of us who are vaccinated, that's going to determine what the future is going to look like. It's possible. One of the latest reports that I've read is sort of saying that this virus may begin now to, in the future, resemble something like the flu or a cold, and that perhaps we'll only need to wear masks during the winter months, and spring and summer and fall, will be safe enough to go about our normal lives, if you will. But again, it depends on how the percentage of the American public that is vaccinated, and it's a possibility that we may need to have booster shots perhaps within a year or so. But that too will depend upon the amount of variants that are that may be circulating out there, and whether or not they gain potency, and et cetera. So it's still sort of too early to tell, but that at least gives us a hopeful glance that if we only need to take precautions, or extreme precautions during the winter months, that still gives us, 3 seasons to have, normal activity, so to speak, and hopefully, again, we'll reemphasize to the American public of the need to get vaccinated.
So we're closing in on the end of our discussion, and I just really learn from you every time we talk. Is there anything else you'd like to share with the advertising community before we close here, Dr. Grant?
Yes, I would say that there's a big role for the advertising community to play. Again, as you're riding down the highway, and you see the signs, or if you think about the long routes that you may see, and a lot of times people will remember that last billboard that they saw several miles back when they're out in rural America. That's that crucial message that they could put on a billboard or a sign or some other type of advertisement, could be very crucial in someone's making the determination that, yes, I will get that vaccine, or yes, I will see that my family members or friends, close friends and relatives are vaccinated as well. I can't underestimate the critical role that the outdoor advertisers could play in helping us to stamp out this virus. So I thank you and applaud you all for the efforts of what you are doing, and consider you a very major partner in this endeavor.
Well, thank you, Dr. Grant, so much for your collaboration, your honesty, and just sharing your expertise with us. And I with you celebrate the work that the out-of-home industry is doing on our behalf. It really is a critical piece to the work that we do. So if you do want to do more and involve your organization on or brand in a vaccine education program, we'd love for you to check out adcouncil.org/COVID-vaccine. Again, adcouncil.org/COVID-vaccine. It's a great way to learn about ways in which your organization or your brands can participate in this effort. And then, of course, if you want to get more information for your own selves on COVID vaccines, where we answer the questions you have with facts and information in partnership with the CDC, please visit our consumer site at getvaccineanswers.org. Again, getvaccineanswers.org. Thank you again. I'm so grateful to OAAA for this opportunity. We wish you all the best.
Thank you.